Good morning, everyone, and welcome. My name is Charity Dublin. I am the president of the Antigua and Barbuda Diabetes Association and a board member of the Healthy Caribbean Coalition. I am absolutely delighted to be your moderator for today's webinar. It is truly such a privilege to welcome you all, to welcome us all to the Back to School, Back to Health, Let's Do Better for Our Children webinar, which is truly such a timely session as we send our region's children back into the school environment. The current NCD marketing the current NCD and marketing landscape causes profound concern. When we look around, 1 in 3 Caribbean children is living with overweight and obesity, and this figure is continuing to rise. The drivers are very clear. We have unhealthy diets that are being fueled by the widespread availability, access, and relentless marketing of ultra-processed products, combined with increasingly sedentary lifestyles. Evidence shows a direct link between exposure to unhealthy food marketing and unhealthy eating habits in children. And it is now widely acknowledged that marketing itself is a key risk factor for the development of childhood obesity. When we look at the marketing landscape, industry interference means a persistent obstacle in creating healthy school environments. While schools have increasingly embraced healthy policies, the unhealthy ultra-processed product industry continues to exert influence through donations, sponsorships, and corporate social responsibility activities. These initiatives provide built-in marketing opportunities, they increase brand visibility, and they cultivate young consumers, all while undermining public health efforts. Since the 2007 Port of Spain Declaration, heads of government have acknowledged the threat of childhood obesity and made numerous commitments to addressing childhood obesity, including supporting health promoting schools. Caribbean countries have made some progress in addressing childhood obesity and the broader NCD prevention. However, there are some persistent gaps that remain. The region is currently grossly off track in meeting NCD targets, as evidenced by the WHO Progress Monitor and the 2024 Port of Spain Declaration Grid. There is an urgent need to integrate evidence-informed, rights-based policy solutions that prioritize child health, eliminate conflicts of interest, and create healthy environments. Additionally, there is a need for coordinated regional action and renewed political commitment as we work to tackle childhood obesity and NCDs. The Let's Do Better for Our Children campaign was conceptualized by the Healthy Caribbean Coalition with support from Heart and Stroke Foundation of Barbados, Heart Foundation of Jamaica, and the Jamaica Youth Advocacy Network. This campaign was launched regionally on April 7th, 2025, to encourage public and policymaker support for healthy food policies and focuses on safeguarding policymaking processes from the influence of the unhealthy food and beverage industry. The campaign has been relaunched as of August 25th, focusing specifically on the back to school season, where post COVID-19 there has been aggressive marketing towards children and young people in the school environment. The discussions during today's webinar aim to reintroduce the For the Children campaign with a spotlight on updated and new materials, to expose and reframe industry-sponsored activities such as school donations and sponsorships as strategic marketing tools that grant the food and beverage industry undue influence and actively undermine school nutrition policies for children's health. We also aim to explore rights-based, culturally relevant, and financially sustainable strategies to eliminate unhealthy food marketing in and around schools, while fostering strong alliances that protect school environments from corporate interference and promote the well-being of our children. Before we advance any further into today's webinar, please permit me to address a few housekeeping matters. We'd love to know a bit about those who are attending today's webinar, and I see we have some of that already coming into the chat. So we're inviting those of you who have not already done so to use the chat to share your comments and to indicate which organization you're from. Please feel free to ask questions using the Q&A function. Our panelists will be monitoring the Q&A in real time and will respond to your questions during the session. I am delighted to turn the mic and screen over to Ms. Tammy Marie, HCC Communications Consultant for this campaign, as she sets the foundation for what promises to be a noteworthy session. Tammy, I'm handing over to you.
Thanks so much, Charity. Hold on, let me just make sure my screen is in order. Hi again, everyone. My name is Tammy, as Charity would have mentioned, and I had the opportunity to work with the Healthy Caribbean Coalition and our partners, JYAN, HSFB, HFJ, to help develop For the Children, which is a social media campaign that really raises awareness about how unhealthy food and beverage companies, often through seemingly generous support, are shaping what our children see, what they want, and what they consume in and around schools. The video you're about to see simply explores how actions like sponsorships, scholarships, giveaways, while all appearing helpful, can subtly reinforce unhealthy habits and undermine the healthy school environments that we're working to build. The campaign is part of our ongoing efforts to challenge the norms we've come to accept and to really advocate for stronger protections that truly put our children's health first. So as you watch the video, I invite you to think about how these influences show up and what it might look like to push back. We can go ahead and play the video, Doriel. Thanks.
Financial donations, sponsorships, scholarships, and branded giveaways from unhealthy food and drink companies may seem generous, even harmless at first glance. But when these companies surround our children with marketing designed to make them crave, demand, and consume ultra-processed products, they are laying the foundation for a lifetime of poor dietary habits and compromised health. We already know the facts. Ultra-processed products are loaded with sugar, salt, and unhealthy fats. We know that overconsumption is linked to obesity, high blood pressure, and type 2 diabetes, non-communicable diseases that are increasingly affecting children across our region. So let's ask ourselves, why do we continue to normalize unhealthy food and drinks in our schools? Why do we allow the very companies that profit from unhealthy products to interfere with efforts to create healthier school environments? By allowing these influences, we're undermining school nutrition policies and sending mixed messages to our children about what healthy eating really looks like. That's why the Healthy Caribbean Coalition, together with the Heart and Stroke Foundation of Barbados, the Heart Foundation of Jamaica, and the Jamaica Youth Advocacy Network, launched For the Children, a social media campaign calling for a ban on the marketing of ultra-processed products in and around schools. We're advocating for school environments free from the influence of unhealthy food and drink companies, environments that truly support children's health and well-being. For the Children builds on the momentum of previous campaigns like Make It Make Sense, People Over Profits, and See the Truth, all aimed at exposing the tactics of the food and drink industry and pushing for policies that prioritize public health over profit. Now more than ever, it's time to challenge the norms we've accepted for too long. Because as a society, we must do better for the children. The marketing of ultra-processed products has no place in our schools, because no aspect of school life should encourage unhealthy choices. Together, we can raise awareness, build support, and push for change. So lend your voice and help us share this message. Visit the Healthy Caribbean Coalition's website to learn more about the campaign. Like and share our content to spread the word. Tag someone who needs to hear this and share your thoughts. We're listening.
Marketing is one of the most powerful tools used by the food and beverage industry to promote their products and to increase their consumer base. And what better consumer base to start with than children?
They come into the schools with their bright colors and their millions of dollars promoting sports while also at the same sports day giving our children beverages which are laden with sugar. That doesn't make sense. How are you saying that we are for sports and athletics and well-being, but you're also giving young consumers unhealthy products and drinks to consume?
Schools should not be marketing zones, and our children should not be walking billboards. We're not against our food companies. We're just against the tactics used to target our children with products that can have harmful effects on their health.
You cannot continue to either sell and promote unhealthy foods to young children. And what the industry can do is to definitely support the process of removing the marketing around the children so that they're not so heavily influenced because they are vulnerable.
We need to do a much better job of creating an environment which helps us as parents to make the right decisions for our children who can't do that on their own.
Over to you, Charity.
Thank you so much, Tammy. And I'm sure that we can all agree that the relaunch of the For the Children campaign, it is timely and it is important. And we're inviting our attendees to ensure that they have a look at the campaign page and they interact with it and the material. One of the most interesting parts of webinars like this is hearing and learning from our attendees across the region. So I am handing things over to Ms. Doriel Quinton, Project Assistant HCC, to facilitate this aspect of today's session.
Thank you, Charity, and also thank you, Tammy, for that brilliant synopsis of the campaign. Very much appreciate that. And Charity, you're right. We want to hear from our participants directly from you. So we're doing this Mentimeter activity, and you can share your thoughts anonymously on Mentimeter by going to www.menti.com and entering the code on your screen, or you can click the direct link that we've dropped in the chat, or you can scan the QR code on your phone. So once you've joined, you can also give us a quick thumbs up so that we know that you're in and you're willing to engage. So you have a lot of thumbs up. You see, we'll give a couple more seconds for persons to get into the room. Great. Okay, so we're going to move on to our first question. And still feel free to join if you haven't already. We wanted to hear from you if you agree with these statements. So you can align the scale from strongly disagree to strongly agree. And our statements here are: school environment should be completely free from unhealthy food and beverage marketing. Protecting children from unhealthy food marketing is a child's rights issue. And our last statement: health neutral or health promoting companies should replace unhealthy industry sponsorships in schools. So far, we have 8 persons who have responded. I'm going to give people a little bit more time to voice your opinions. But so far, we're seeing very strong agreement with these statements. Yes, looking great so far. I'm going to give persons just a couple more seconds to lock in your answers. Okay, this is great. So we're going to move on to our next question. And this is really where you can rank what you think are the biggest barriers to banning unhealthy food marketing in and around schools. You think it's our financial dependence on these sponsorships, limited public awareness, demand for change, maybe it's the government has competing interests, and maybe there's just a lack of political will and that momentum to ban these marketing? Or do you think it's opposition from the food and beverage industry? So we're seeing at the top of the ranking our financial dependence, which is true. We do have limited finances, and these sponsorships do help fill that gap but that also really shows us the need for having health neutral and health promoting companies step up to fill that gap. I'm going to give persons a couple more seconds because we have quite a few replies. This is really great. Yeah, so we have financial dependence and limited public awareness, followed by competing government interest and opposition. Great. And for our final question, so this is an open-ended question. We want to know, what is one bold action you believe that stakeholders, whether government, civil society, private sector, everyone can take to support a ban of unhealthy food marketing in and around schools? One bold action. And since this is open-ended, I'm going to give persons a couple seconds, to think through what they think would really help us to support that ban. So first off, we have legislation. Yep, definitely you need the policy. Introduce healthy foods in the cafeterias and educate stakeholders. Yes, that is very important, keeping that environment healthy and making sure everyone involved knows how to play their part. Implement school nutrition policies that also include a ban on marketing. Parent engagement, that's very important. Going to schools, you should really be looking to the PTAs to get their support. Reduce taxes on water, collaboration, promotion policies, support healthier brands instead, healthier alternatives, policy. Of course, we see that recurring point policy. So it's definitely important to have that. Legislation, parent engagement, monitoring of implementation is a very important part. And thank you, everyone. Could go on forever, but thank you so much for engaging with us and sharing your views. And I really hope that our panelists can also, feed off of this and probably include in their panel's remarks, maybe see how they can also incorporate your bold action. So thank you very much for sharing your views, and I will pass it back on to Charity. Thank you.
Thank you, Doriel. It's always really fantastic seeing what our participants have to say, and I think the suggestions for bold action were especially interesting to watch come in. We are now at the part of today's webinar that I know a lot of us have been really looking forward to, and that is our panel discussion. It's featuring a very dynamic group of individuals who will share their knowledge and their experience as we explore how corporate sponsorships and marketing practices influence children's health in the Caribbean, and also aiming to identify rights-based, culturally relevant, and those financially sustainable strategies that we spoke about before as we aim to eliminate unhealthy food marketing in and around our schools. Our panel today includes, as I said, it's a really diverse, really dynamic, and I'm just going to invite them to open their cameras and their mics as we gear up for today's session. Our panelists include Dr. Asher Pemberton, consultant pediatrics and adolescent medicine, Sandy Grande Hospital, Caribbean Vice President, International Association for Adolescent Health, Shanique Bowman, Executive Director, Jamaican Youth Advocacy Network, Miss Jan Phillips, Advocacy Officer, Heart and Stroke Foundation of Barbados, Mr. Paul Innes, Executive Vice President and General Manager, Barbados Operations Sagicor Life, Mr. Anthony Green, President, Caribbean Broadcasting Union, General Manager of Voice of Barbados, Miss Cyan Roll, National High School Youth Ambassador, the Bahamas. So we have a fantastic group of panelists on today, and we're going to jump right into it. So our panelists have a lot to pack into a very short time, so we have definitely issued a challenge, but I know that they're up to that challenge. We're moving to Dr. Pemberton. As a pediatrician, what health challenges do you most frequently see among children living with overweight and obesity, and how do these conditions affect their daily lives and long-term well-being?
Thank you so much. So I have been in the pediatric and adolescent space in the Caribbean for 20 good years now. And I can say that at the beginning of my career, as compared to now, the medical complications, which we hear about a lot, certainly are rising. So the rates of insulin resistance, type 2 diabetes emerging in adolescents, which is something back in the day was pretty much unheard of. It's now standard. Rates of hypertension, the levels of menstrual irregularity on young girls and adolescent girls. So whilst I want to remind ourselves about these physical health challenges, it's really important to me for us to recognize that the silent effects on their health and well-being are often emotional and psychosocial. At the end of the day, overweight and obese children and teens are aware that their bodies are not healthy. There's a difficulty moving through the world in a bigger body. And we have to remember a primary part of adolescent development is around identifying with peers and connecting with your social group. And so the low self-esteem, the low self-confidence, and the low self-concept that overweight and obese children and adolescents develop by virtue of feeling differently has a spin-off effect in their ultimate behavior. You find that they are less likely to engage in sports and activities. So whilst on one side, the clinician saying, you just need to go to the gym, you just need to walk, it hurts to walk. It's hard to walk. Their cardiovascular tolerance is not normal. And so insofar that we try to put interventions in place, we have to recognize that their bodies are not normal bodies, right? And they feel that much more conspicuous. So the emotional health effects, the self-esteem effects are sometimes the larger ones. And what we see in clinical practice, and again, in my space as an adolescent professional, is the high-risk behavior. So an adolescent or an older child with low self-esteem is more likely to binge more, is more likely to recluse themselves from social activities, is more likely to engage in self-harming behaviors, high-risk behaviors of all kinds. And often when you drill down, the root at the core of it is low self-esteem due to their body weight and shape.
Thanks so much for that. You mentioned that you've been practicing for over 20 years and you've seen that rise in childhood obesity. Over that time, we've also seen the rise in marketing towards children. So can we zero in on that a little bit? You penned an article last year about commercial influences on child health and on adolescent health, where you highlighted how young people are uniquely vulnerable to targeted marketing. Why is a comprehensive ban on unhealthy food marketing in and around our schools essential? And what difference could it make for children's health outcomes in the Caribbean?
It can make all the difference. So if we go back to the neurobiology of late childhood and early adolescence, a couple of things we need to remember. The frontal lobe, that executive functioning center of the brain, is simply not complete in maturation until age 25. And so young people do things that feel good over and over and over. And that is exploited by all of the industries. The gaming industry knows this, social media knows this, and the food industry knows this. Because ultra-processed products taste good, they're crunchy, they're sweet, they're salty, their dopamine drive happens, their executive functioning centers, as I mentioned, are not as developed, so they keep doing things that they enjoy. And so this is not their fault. They are uniquely targeted. And so again, if the environment continues to provide them with these options, and these things feel good, why would they not do it? And so again, the simplistic, oh, just make better choices goes so far, but we have to recognize that these are children and adolescents. Second of all, as I mentioned before, adolescents want to fit into their peer group. And so the food industry and the fast fashion industries, they know this. And so the rate at which they keep throwing out products that some people can enjoy and some people can purchase, everybody wants to fit in. So again, unless our environment, through a comprehensive ban, removes these items from their most intimate environment, and their school is one of their intimate environments, it really becomes difficult to ask a developing brain to make these choices one by one by one. When some people are doing it, They don't want to feel excluded. So it's really, I think if we look at it from a developmental perspective and a child rights perspective, as the adults and carers and clinicians, it is truly our responsibility to recognize that this is a population of young people who are in development. We cannot ask them to make decisions that they don't have the capacities to do. We have to create an environment that is best supportive of their health and development.
Thanks so much for that, Dr. Pemberton. And you mentioned the right of children to these healthy environments, and that's taking us right over to Shanique. Shanique, the Jamaica Youth Advocacy Network has long advocated for child rights in Jamaica. How does the marketing of unhealthy foods violate a child's rights? And how can framing the marketing of unhealthy foods to children as a rights violation strengthen advocacy efforts and galvanize stronger action from policymakers?
Yes, thank you, Charity, for that question. So definitely, marketing to children, marketing of unhealthy foods to children is not just a health issue, it is a violation of rights. When we think about the fact that Jamaica and many other Caribbean countries are signatory to the Convention of the Rights of the Child, which requires our states actors to have a overarching obligation to protect the best interests of children and to protect their rights. Many of that trickles down into what we see in our local laws. So for example, in Jamaica, we have the Child Care and Protection Act, which speaks to many rights that our children have, one of which is, the right to education, right to information, those sort of things. But even at the larger international level, we have things such as the right to health, the right to adequate nutrition, the right to freedom from exploitation, and marketing is in of itself exploitation. And so when we consider that those are some of the immediate rights that we see children in access or overarching access to pervasive marketing are violating, that causes to question the need for our states to make stronger groundwork and provisions to ensure that children are protected. So if we even take the education system, for example, which as we know is already in and of itself a regulated environment, it should not be a case where our state actors are allowing undue influence to be within the education system and education space to exploit our children. So when we see companies come in with their bright, colorful cartoon billboards and their merch and those sort of things, that is not only just impacting our children from a headspace of exploitation, but also infringing on their free access to education in a way. And so one of the key things that I think we need to think about when we consider how rights-based framing can impact our advocacy is that at the end of the day, our stakeholders recognize that they have a duty. But what they may not always recognize is that there needs to be a shifting of power to children that recognizes children as rights holders. When we have marketing things in their face, that takes away an element of choice because they're not also being bombarded with the alternatives in the same way that they are with the unhealthy food and unhealthy products. And so when we allow one entity to sort of dominate the space that they're occupying, that takes away an idea of choice from them that infringes on their own duty to exercise their rights in the same way, in the ways that they would want. There's also just generally a moral and legal obligation where we recognize that a health framing often appeals to prevention and cost saving. And so our politicians especially will recognize that when we say things like, NCDs are costing billions of dollars a year, that means something to them. And so when we shift and focus on their need to ensure that they are protecting children who are now seeing increased rates of non-communicable disease at their young age and how that may translate into adulthood, that can also be a way to strengthen our advocacy and influence them to take action. Thank you.
Thanks, Shanique. You spoke very heavily about that rights-based framing, and we know that the Jamaican youth advocates have been instrumental in championing the school nutrition policy, highlighting how children's rights must be protected in education and health settings. Could you share some specific ways youth advocates within your organization have contributed to advancing the school nutrition policy?
Yes, so definitely. I mean, one of the things about our story at JYAN is that we came into the healthy food policy space specifically to ensure that youth voices were being included in the discussion. So our partners, Heart Foundation and CARE and UNICEF, were doing the work, I think, long before we came on, but we had a very specific agenda to come in and ensure that young people were included and their voices were heard. And we started very simply with just ensuring that we're doing capacity building. We want young people to be informed and to be able to make informed choices that they can also translate into advocacy. And so we engage a lot of different young persons from different groups, from different parishes, from different backgrounds, who may not have interfaced with this idea of a healthy food policy before, and we are trying to build their capacity to do meaningful work in their communities. And that's where we started. But some of the immediate things that I think we are most proud of in terms of how we mobilize young persons and their support came around when we started talking about the school nutrition policy, for example. And so when the school nutrition policy came out, the draft policy came out in around May 2022, one of the first things that we did was we did a joint youth submission led by JYAN, which we included different student groups and other organizations, both at the secondary and tertiary level, to pull together an analysis of the draft policy and to offer further submissions. And so we were able to participate in that submission process. And then when the time came for the youth consultation, the student consultation later that year, with support from UNICEF and in partnership with UNICEF rather, we were also able to do a U-Report poll, which allowed young people to share their thoughts and about the school nutrition policy and showed overwhelming support for the school nutrition policy and what it entailed. We also did a 2-page version of the school nutrition policy to ensure that the most pertinent information was in the most accessible form for young people. And one of the things that we've noticed and that I think I'm personally extremely proud of is that the way in which we've gone about our advocacy has created a sort of ripple effect where more young people are now recognizing the agency of their choices, and they're now recognizing that there's more information at their disposal around the impact of these unhealthy foods. And so I've seen firsthand where just by coming to a JYAN workshop or event, young people are now posting on their own social media about, how unhealthy this product is, or how, they never realized that this had so much sugar and that we need to do more things about that. So we see more for youth advocates and more young people in general, sort of leading in their own spaces, whether at school, whether at, online, whether in their communities, to bring the awareness. And of course, lastly, I want to use my last few seconds to just also focus on how we engage and mobilize youth support around the Hope for the Future initiative that was spearheaded by the Healthy Caribbean Coalition in partnership with many, many organizations across the region. And so even one of the highlights of that was we had our event, we had a little over 60 young persons in attendance and over 200 signatures coming out from our open letter. And so that I think may not be a direct influence, but I do think influenced the finalization of the policy that came a few months ago. Thank you.
Fantastic, Shanique. Thank you so much. JYAN is doing such amazing work, and you are truly trailblazers. At both the beginning and end of your statements, you mentioned partnership and collaboration, and I think that brings us beautifully to Jan and the Heart and Stroke Foundation of Barbados, who have taken a collaborative, multi-stakeholder approach to the implementation of the Barbados School Nutrition Policy, engaging policymakers, parents, vendors, concessionaires, and the youth. Jan, could you share a bit about this work and how it has contributed to advancing the policy?
Thank you, Shrita, and good morning, everyone. And thank you, HCC, for the invitation to share. So we took a deliberate and collaborative approach to supporting the development and implementation of the Barbados School Nutrition Policy. We focused first on the building a strong civil society base united around one single goal, and that of making compelling case for the SMP. So this led to the formation of the Barbados Childhood Obesity Prevention Coalition, as we know it today, in 2019. And it's now a group of, I am happy to say, 30 civil society organizations, along with individual experts, concerned citizens, and a youth subcommittee of approximately 50 youth advocates. And that's another thing that we're really proud of. So as the coalition developed, we began engaging key stakeholders across various sectors, all of whom, of course, were critical to the success of the policy. One of our earliest conversations in 2019, which I remember, was with the Barbados Association of Retailers, Vendors, and Entrepreneurs, who offered their immediate support. It was extremely encouraging for us. So we then focused directly on the school environment, which included principals, teachers, and parents alike. We held sensitization sessions with school management and did outreaches at parent-teachers meetings. We didn't forget anyone at all. as well as developed an annual parents forum session online. Parental buy-in was critical, and in May of this year, we took the parents' collaboration further to deepen that engagement. We hosted our first national PTA executive session online. This was really to equip PTA leaders with the knowledge and tools to advocate within their school spaces for healthy food environment. We had to get them online. We also, within the schools, engaged with the canteen concessionaires and vendors, and this group was particularly important as without their full support, the SMB would have significant challenges. So recognizing their role, we designed a session for them, which has become an annual training program, and these sessions positioned them as really key partners to us. We also launched a pilot model school program in 6 schools to galvanize support for the SMP policy, test the implementation by identifying challenges and gathering best practices in preparation for a rollout of the national policy. We brought on schools who were already working toward a healthier school environment. Key elements included written commitment from principals, and this one was very difficult, removal of soft drinks from the schools. Then there was vendor training, teacher and parent sensitization sessions. So some major wins for us came over time as we held meetings with various government ministers, including health and wellness, educational transformation, sport and energy, and business development, which led to some meaningful collaborations, as was just mentioned by Jamaica Collaborations. And it culminated in the official launch of the SMP in February of 2023, which included a mandatory ban on sugar-sweetened beverages in schools and a phased rollout of the full policy. So let me very quickly share a few collaborations we had. So HSFB partnered with the Ministries of Educational Transformation and Health and Wellness to initiate a recognition reward pillar of the SNP in November 2024 and February of this year. The canteen concessionaires and primary schools, respectively, those that started to implement the school nutrition, they were rewarded. Another win came in gaining civil society representation on the school nutrition policy implementation committee, and that was really big for us. This guarantees that community voices are part of ongoing policy implementation. Another collaboration, and that happened just last week with the Ministry of Health under the School Meals Department. We led a 2-day session for the school meals cook, whose understanding and support of the policy is key to its sustainability. And finally, our youth advocates arm remains a really integral part of the advocacy through their school tours. They visited 72 schools in Barbados, and they use engaging presentations and fun games to deliver the messages on healthy livings. And our youth advocates, they've also developed strong presence online, including live sessions, maintaining an active and youthful voice. That's some of the stuff that we've done. Thank you.
Fantastic, Jan. And very quickly, we know that the foundation has recently launched a mass media campaigns addressing ultra-processed products and banning marketing in schools, the Out of Our Schools campaign. Can you share more about these campaigns and the impact that they have had on public dialogue and on policymaker engagement?
Sure, Sharita, very quickly, because alongside community and stakeholder engagement, we place strong emphasis on our mass media campaigns to amplify the key advocacy messages to shift public norms. They have really become a big thing with us. So in March of 2025, this year, we launched a campaign to ban the marketing of the unhealthy foods and drinks in schools, a key driver of poor dietary habits among children, as we know. So we're now rerunning this campaign on social media. It started in August, on August the 18th, and it runs until September the 12th, which of course strategically aligned with the start of the new school term, which was last week. So the campaign had earlier garnered over 145,000 impressions on Facebook and more than 60,000 on Instagram, a strong indication of public interest. These campaigns have helped spark and sustain national conversations around non-communicable diseases, healthy school environments in Barbados. So the ban on marketing policy area, it will remain a strong focus of our mass media campaigns as we move into 2026 So our plan is really to bring the forefront the harmful effects of ultra-processed products, which currently form a major part of our food imports and what we see on the supermarket shelves in Barbados daily. The impact of these campaigns have been really meaningful for us. So over the years, they've helped elevate the visibility of the school nutrition agenda. And this has led to direct engagement with key government ministries, including health and education, sports and business. Most recently, and I love that this happened, we met with the Honorable Chad Blackman, and he's the new Minister of Educational Transformation. He has expressed full support, both as a minister and in his personal life for the campaign, and he acknowledged the urgency of protecting our children's health, helping to further create additional momentum. So we shall wait and see where that goes. We hope it shall go very far.
Awesome, Jen. Thank you so much for sharing. And the Heart and Stroke Foundation of Barbados, you've done such phenomenal work as it relates to promoting public health initiatives that aim to provide a healthier environment for our children. And another organization that has had a strong history of supporting public health initiatives in the region is Sagicor. So, Paul, we're inviting you to share some examples of this work as it relates to promoting public health initiatives and how these efforts align with creating healthier environments for children.
Thank you, Charity, and good morning to all. It's a pleasure to join with the other distinguished panelists to lend support to this important discussion. So, as a regional organization, we have a very simple view about our communities. If you were to look at our vision basically is to actually contribute to our communities to actually improve the living standards of everyone in the communities in which we operate. So if you were to bring that to life, in a practical way, outside of traditional marketing and CSR projects, we could not ignore our responsibility to our society, especially as a life and health insurance company. We couldn't ignore our responsibility and not do something tangible and direct that actually benefits those in the society. The other angle that we have looked at it from relates to how could you have a successful business community or company if the people in the community that are your customers are not healthy? And it is something that we thought we could not ignore. And when I joined Sagicor in 2020, during COVID, it gave me a lot of time to understand the company, the issues in society, and also to help determine what should be our strategic focus. And one of those priorities came out of a very simple exercise I had at work. When I joined the company, we have full-time nurses, and they actually came to me and said, we want you to know your numbers, and we want to know your numbers. And that was around some basic checks around hypertension, cholesterol, and diabetes. And it was the first time that I found out that I was pre-diabetic. Now, I look fit, I do exercise, but I was fooling myself based on my diet, right? And then I thought, we should probably do this internally. And by extension, we thought that we should do it externally. And we actually came up with the Sagicor Cares program, which is a local program that we will make regional. And we have partnered with the Barbados Defense Force Medical Unit and the Cancer Support Services, as well as other partners. And on a monthly basis, we go into the communities within Barbados. It is our intention to do it over a 3-year period where we actually go to every parish in Barbados and where most people assemble and help our people really understand and appreciate the status with regard to their numbers. And in less than a year, we've been able to touch over 1,200 people. And in some cases, we were surprised to find out that there were people who never were screened before. And their screening resulted in conditions that they were not aware of. So that is a practical way in which we thought we should actually engage and participate and be part of the solution.
Thank you so much, Paul. You spoke about going into communities, and we know that schools, they form an integral part of our communities. So I have a question for you related to schools and the school environment. In light of the financial constraints that we know many schools face, how can health neutral or even health promoting companies step up to fill resource gaps in ways that are not only ethical, but also transparent and aligned with national health and education goals?
Well, very interesting question. And this year and the next 2 years, I have a interesting contribution to make because I also sit on the National NCD Commission in Barbados. And it turns out that I'm now the president for the Barbados Chamber. So to your question, I'm actually working through, trying to coordinate between business, Ministry of Health, and other stakeholders, how the business community, and this for me is not a Sagicor position, this is not a business community position. How can we, understanding the nature of the lease and the requirements, how can we pool resources and become more effective in the strategy to help manage the concerns around companies that actually pitch to all kids on healthy foods and so forth. It is a balancing act for me because you would appreciate that some of my constituents, certainly from a chamber perspective, maybe are some of those companies. And quite frankly, in talking to a lot of them, they actually want to be part of the solution as well. I don't think we have figured it out, right? So there's some work that I'm doing there, but for companies like Sagicor, we started adopting schools. And what that means, and that is across the Caribbean, because we're having these same conversations across the Caribbean, we want to understand what are the needs of the schools. So maybe rather than some of the physical requirements that we tend to financially meet, quite frankly, outside of water coolers and so forth, no school has ever said to us, why can't we devise a healthy program? And maybe that is where we partner with the Heart Foundation, HCC and others to actually be part of what is happening within the schools. Because I find in the business space, too many agencies are coming to business houses independently, and everybody's trying to achieve the same result. And there's limited resources, limited capacity, and we have to find a way to harness the resources and actually focus them where they are needed. So that is part of the work that I'm trying to make sense of and see how we can partner with the right partners to be effective.
Excellent. Thank you so much, Paul, especially that detail on harnessing resources. I think that right there is going to be critical as we move forward. And we are moving on to Anthony. Anthony, how can the media work more closely with civil society and public health actors to raise awareness and advocate for healthier food environments for children?
Thank you very much, Charity, and good morning to everyone. Great to be here. One of the things that the CBU has been reinforcing is the need for, strengthening of partnerships and understanding of our various organizations, certainly on a broad level when it comes to the media, but also within the health sector. And usually, the media is seen from a perspective of reporting the news, and we have our publications, newspaper, radios, about the music, promoting our events, and so forth. And these roles are important aspects of what we do, yes. But we are also a very important part of what I would refer to as a communication ecosystem. And it is therefore important that the media at a strategic level is included in your journey, for example, for a few good reasons. And there is a good understanding of what we do, how we work, and partnerships that could help you to reach your objectives. And we already have good examples of this. And I've been recently celebrating the HCC CBU partnership because that's a great example. We had our CBU AGA just last month in Barbados, and the HCC was a part of it. In fact, they were the main feature at our conference day. And it was a great job in the way that you brought young people in to dramatize important messages relating to your campaigns and to sing songs that they made up of how children can be protected from harm as it relates to the campaigns that you develop. What did something like that do? Well, they were speaking to media executives. Essentially in that evening as well, research was shared with those media executives. And again, that's important because there's a lot of good research that is done in the health sector, but we find it's hidden away in journals. And it really never comes to the fore for us to be able to unpack and share with the public. And that is an area in which we can improve. You could also look at the perspective that even information that's shared sometimes, it's not necessarily easy to understand if you're not in the health sector. So the way that that information is presented, again, would make it difficult to break down and to share. So the point I'm making is that what these partnerships do is that they help us to understand each other. And then we're able to look at how can we then make progress in holding hands together to achieve these important objectives that have been spoken about here this morning. One of the areas, again, that has been strong in the HCC-CBU partnership is the incentivizing of journalists to pursue stories that are health related in relation to protecting our children. And we've seen an increase in coverage because of that. One of the things we have to remember is, like everybody else, the media could be challenged with resources. When incentivizing happens, what we find is that journalists are willing to spend extra time because they take pride in the work, and they're then willing to find the time to be able to do a bit more investigative journalism around particular issues. And I mean, we've had a record year for awards in 2025 for our entries. For the CBU Media Awards, and among that were among those were stories that specifically look at health. So those are very strong examples of partnerships that I think help to exchange knowledge sharing. One of the things we must remember is that the media personnel are not necessarily subject matter experts. So very often we'll say it's important for the media to look at this issue or that issue, and that is true. But we need to be able to have relationships with subject matter experts that can help us to qualify the information. We take very seriously how we reference our sources when it comes to information. As you know, social media has created that storm. It's good because that is where people are. It's good to reach people there, but at the same time, it creates misinformation and disinformation and so forth. Mm-hmm. When we sorry.
Thank you so much. I don't want to distract you, but something that you mentioned earlier, and in the interest of time, I just want to hone on to this. You mentioned that media has a variety of roles, and I think you started to address this question, but I just want to focus a little bit more on this. In terms of the roles of the media, what role can your organizations play in amplifying evidence-based messaging and challenging industry narratives, as well as supporting those campaigns that prioritize children's health over commercial interests? So if you could very briefly summarize that targeted question, I think that would provide a lot of insight for us.
Yeah, sure. Well, the first thing I want to say in response to that is that the media is very interested in sharing information that help our populations. So very often you get the newsrooms and the journalists who pursue that. Our advertising departments are usually very separate. And so when we talk about prioritizing commercial interests, while I can understand that it may appear that way, you have passionate journalists within our industry who are willing to be able to share information that will benefit people. And I think it's important that we continue that. Now, we need to have more programs, I think, that look specifically at youth and children. And there needs to also be greater awareness. And we appreciate the call for that awareness in terms of where we place advertising, for example. And that happens already with certain topics that we members pursue on media. You may find that programming will be reserved for a certain time of day, for example, or we will refuse to support certain types of content with certain types of organization advertising. And I think that greater awareness needs to continue. We need to continue to make prime time available to these kinds of causes. If I put on my Starcom Network hat, I think of programs like the Greenback Moment of Health, which comes in the morning. I think about promotions like Hot Summer Burn, which encourages exercising. And I think about on the newspaper side of the Nation newspaper, the Better Health magazine. And I think while we have done a lot of that, given a lot of exposure to these kinds of issues, the question is, if it is that we in Barbados and across the Caribbean have challenges with health that we need to address with children with diabetes, with non-communicable diseases, then it needs to be a continuous effort in bringing these things to the fore. And I think the media remains in a good position to be able to do that.
Thank you, Anthony. The media truly is a key partner as it relates to our health promotion activities. And I think you've given us a lot of food for thought as it relates to how we can truly use these partnerships and these relationships to the full extent that they can offer us. Thanks again, Anthony. And we are moving on to our last, but by no means at least, the panelist, who is JYAN. JYAN, you recently participated in the Hope for the Future event in the Bahamas in July of this year, which brought together ministers of health, education. It brought civil society and other key stakeholders on board to discuss the importance of healthy school food environments. Can you share a bit more about your experience and what were some of the key takeaways that you got from that activity?
Participating in Hope for the Future was an amazing experience, and it made me so happy to see all the different sectors, such as the ministries of health, youth, and education, as well as representatives from PAHO and WHO, come together to address such an important issue. And seeing all the statistics presented at that event really emphasized to me how serious of an issue this is. But I'd say one of my key takeaways was collaboration. It reminded me that as a youth leader, it's not just me who can drive change. And I think that can be said for the Ministry of Youth or the Ministry of Health or Education. If we want to make a change, if we want to create the healthier school environments that we want to see, everyone's input is needed.
Thank you, Cyan. You're such an amazing youth leader. And as the youth leader that you are, how do you see young people meaningfully shaping school nutrition policies? And what steps do you think are needed to ensure that youth voices are able to influence and make real change?
I see young people shaping nutrition policies in an effective and dynamic way, especially those who are still in high school. I just recently graduated, but they're there for 5 days out of the week, and they would have the best ideas as to how we can make these healthier school options more appealing to them. But I think the first step needed to ensure that their voices influence real change is opportunity. I know that in the Bahamas specifically, we have youth in parliament, we have youth in Senate, and we have high school leaders. I know, speaking from personal experience, that without being a member of the National Youth Ambassadors Corps, I would have never had the opportunity to speak on this issue in the first place. So there's so many we need youth need the opportunity to speak to stakeholders and to speak to policymakers to voice their opinions and advocate. And secondly, I would say having programs or events where we can specifically hear from youth is very important as well. I remember participating in Hope for the Future last summer, and students spoke directly to me and my fellow youth ambassadors about their school environments. And I remember thinking, oh, this is something people my age are invested in. This is something that they care about, as they should be, because this is something that directly impacts us. So events such as Hope for the Future, which opens doors for students to give their input and voice their concerns, are really important because we're giving out these statistics, we're presenting this data, and I think we can now move to asking the people who are impacted most, what do you think we can do now?
Thank you, Cyan. Amazing, truly amazing, especially where you mentioned that yes, we're doing all of this for the children, but we want to ensure that we are involving the children, the youth, the young adults in these choices that really and truly are for them. But we want to ensure that these decisions are made with them in mind, but not only that, with their consultation and their input. We have had such an awesome discussion, and I'm ready for that discussion to continue through the Q&A. So we're just gonna pop, there've been a few questions that have come in. We are inviting our participants. Feel free to pop your questions into the chat and we'll see how many of them we can get through. There's a question here, and I think this one I'm going to offer this one to Jen. And this question is, I realize that we make mention of the school's canteen, but I want to go a step further and ask, how do we integrate the vendors selling outside the school gate/yard into this program so that they do not sell these unhealthy foods to our children? So Jen, can I toss that one your way?
Sure. Thank you, Charity, for that question. In a phrase, moral suasion, but moral suasion does not always work as we would want it to work. The problem is that the vendors on the outside of the schools, they don't fall under the Ministry of Education. They fall under a completely different ministry. Now, what we do when we do our vendor and canteen concessionaire sessions, we try to include them. We invite them to the sessions. Some of them will show, others won't. At the end of the day, unless we get a policy that specifically speaks and draws them into the process, it's going to be somewhat of a challenge, but we live in hope, because sometimes what we do when we visit schools, we literally step on the outside and we have a chat with them. And sometimes they'll say things like, oh, but we didn't know this and we didn't know that. But then when we're gone, the healthy products are on the inside of the schools, and then the children come on the outside and they'll tell you, well, I still got to feed my family. So it's kind of it's kind of a difficult situation, but we really do need a policy for it. What the school nutrition policy does, though, is speak to that specific thing. There has to be a way to draw them in. Right now, we're still having conversation with the other ministry that will draw them into the process. Until such time, we're going to keep pushing. We're going to keep pushing. But please know that we are doing something about it.
Thanks so much, Jen. And as you mentioned, in the absence of official policies, those informal channels of communication, I think they play a vital role as it relates to those vendors operating on the outside. A small conversation could, in fact, spark some inkling of a change until we get to the point where we want to be. There is actually a follow-up question. Let's see what that looks like. So it says, great question, a follow-up. How do you think public education efforts in the schools can realistically compete with the kind of coordinated marketing that we already know is happening behind closed doors in the corporate sector? What role do you see for journalism in making those dynamics more visible to the public? So this is a two-part question. So I'm going to read it again. So did we get that,
No,
Jan?
go ahead.
Okay,
read the first part first.
Because I think that first part would go to you. So it's, how do you think public education efforts in the schools can realistically compete with the kind of coordinated marketing we already know is happening behind closed doors in the corporate sector? So that one will go to you, Jen, and then the follow-up will go to Anthony. So over to you, Jen.
Right. No, let's just say that what we do in terms of sharing information is absolutely key. When we started back in 2019 and we visit a parent teachers association, wherever we go, they will say to us, but we did not know of what you speak. Public education is absolutely key. If we don't have public education, when the marketers come and they put their products in front of the people, they will just accept them. We have to keep educating people so that when the marketers come with their products, they say, but no, we heard about that product and we are now aware what it does, so we don't want it. We have to keep educating the people. It's a situation where you go into the supermarket and just, you pick up things. You don't read the labels. You just pick up things. Once you get that education and you realize what is on that label, once you understand how marketing, advertising works, how it keeps things top of mind, once you understand that, then you can make decisions that will benefit you and your children. But continuous education is absolutely key. Yeah, thank you.
Fantastic. Thank you, Jen. And we're just going to follow up on what Jen just mentioned with the second aspect of that question, which we're tossing the ball over to you, Anthony. What role do you see in journalism in making those dynamics? Sorry, what role do you see for journalism in making those dynamics more visible to the public?
Yeah, I'll just pick up from where John left off, because I think the Heart Foundation has been a great example. She spoke about the 2019.
Anthony, just a moment. I'm not sure if it's true, but we're having some difficulty with you.
Okay, I'm sorry. I'm hoping that this is better. And
yeah, much better.
I'll pick up from where John left off, because I think Heart Foundation is a brilliant example of how they have gone about impacting on policy. And I think, you know, within the space where campaigns are developed, it takes communication experts and marketing experts to do so. So that's the first part of the question too, that your bodies have these individuals there as well, which is good. You're embracing communication and marketing, you know, to be able to counter certain messages, or at least put your perspective on the table. And that's where journalism has an interest. Now, the Heart and Stroke Foundation, I remember when they developed that campaign, you know, no sweet drinks in school and so forth. Stockholm Network, I'm the general manager of Stockholm Network, and I remember I was manager of content then, and we had conversations about Heart and Stroke Foundation being able, through our programming, to bring their message to the fore and start a conversation or continue a conversation or intensify a conversation about why these issues are important. Did it work? Yes, it did. Were they consistent? Yes, they were. To the extent that you then had a national conversation that was happening around policy. And it is that consistency. Yes, we're going to be interested in all the views, so we're going to put all the views on the table. But when you are coming to the fore with your, like, again, you're subject matter experts and you are available to come to the table to have the tough conversations, we facilitate them. And it is through that consistent conversation, through that consistent messaging, that the country then start to sit up and say, well, hold on, this is important, and they get an interest. And when you have the country having that conversation, that's where it starts.
Awesome. Thank you, Anthony. And pulling out that consistency in terms of the messaging and the exposure. I think that's definitely important. Shanique, we have a question for you. So question for Shanique from Jamaica. We have an interesting culture in the Caribbean where people, oh, 1 second, where has it gone? Where people believe that children and youth, by extension, should be seen and not heard. Did you and other youth receive any pushback during your advocacy work? If yes, how did you deal with this?
Yeah, that's a very good question, and yeah, it's a very real reality that we still contend with here in the Caribbean. I can't immediately say that we did receive any like notable pushback, particularly in the context of JYAN does other work outside of the healthy food policies. And so if we compare even the pushback that we may get from other things, other issues like sexual and reproductive health rights issues and those sort of things, it's very different and minimal when compared to healthy food policies. I think largely because it's not a controversial issue. I think when we think about children and wanting them to be healthy and wanting them to live long, healthy lives, for the most part, we all unanimously, or any well-thinking person would agree on that. I think maybe the only persons that may not agree are the profit makers in the industry. And so realistically and admittedly, no, we didn't get any significant pushback. I will say that we did interfere with some conflict issues, particularly within the schools. So we might, for example, have wanted to do a photo shoot on a school compound using their canteen to do a video campaign that we're trying to do. And the principal was saying to us, you guys came and you talked to our students about this the school nutrition policy, and I'm definitely on the same page that you are on, but our canteen is owned by XYZ, and I realistically can't have you come in and do your video, even though for all intents and purposes, I get what you're saying and your message is clear and we're on your side, sort of thing. So short answer, no. I think largely because it's not a significantly controversial issue, and the extent to which it is controversial isn't something that we've personally at JYAN interfaced with a lot, but may have in like other circumstances.
Thanks for sharing your experience there, Shanae. There was a question that I believe would be directed to Paul. Here it is. So Paul, how can we get more private sector organizations like Sagicor to fill the financial gap? How do we better encourage and appeal to you to support the cause?
So good question. And I think the business community needs to really understand the focus and the work that is being done in Barbados and across the region. Because of where I sit and what I know, as an organization, we have started engaging with, for example, we met with the leadership team in St. Lucia, their main hospital, to actually devise a program, a national program, and how our company can actually work with them. And we're working to do that across the Caribbean. From our perspective, and this is from a surgical perspective, our sweet spot is really the family, because we recognize that though the target for a lot of the unhealthy food is towards our kids or children, in the family framework, if sometimes in Barbados, if you were to just take note, sometimes you drive into work on the street early in the morning, you might see a parent with a child and they have a Coke as part of the morning commute, whether they're consuming it on the way or when the kids get there. And a lot of parents are making a lot of unhealthy choices or not the best choices. And that is why we came up with the Sagicor Cares program, because we thought if we can tackle the family, where we encourage the parents to bring the children, we can actually probably have a very good chance and shot at influencing and informing. But I think JYAN actually made the best point, and I think the business community can probably support, I would say, the comms plan, the comms strategy that needs to be sustained over a period of time, which will require resources. And that is probably one of the areas in which we can meaningfully help in building out a sustainable communications plan to help with informing, making sure people have the information they need, so that when the advertising and the targeting happens, because it will happen, we work in and live in capitalist societies, people can actually make better decisions because they'll have the information that they need, you know.
Thank you so much, Paul. There was a question, another question directed at Anthony. It says, thank you, Mr. Green. What are some specific tips you would give to society to engage better with the media?
Okay, well, it's a very broad question, so it really depends on which aspect of the society you're talking about. But for sure, if it is just we're interested in information that impacts people. We're interested in stories, and contrary to what we believe, not only stories of a controversial nature, but we are interested also in stories that where people win, for example, where there is improvement, you know. And I think very often these stories are out there, but they need to be brought to our attention. And that is one way that I think that we need to be able to see ourselves in that positive light. When you see something positive happening, when you see something that is different, that's a win, a challenge that has been overcome, just don't keep it to yourselves or among your circle. Share it with us so that we can put a spotlight on that. So easy for the negative to be highlighted, but there are a lot of positives happening around us that we need to report. We need to share those positive things, and we talk about amplifying. But that's something that then we can amplify and say, look, you know, here is what's happening that is good among us. Sometimes we get those stories. I think we get those things happening, but it's far and few in between. So that's a tip, and that's at every level, whether it's research, whether it's something as simple as happening in your family, in your neighborhood, in your society. I think there needs to be a greater commitment to sharing that positive information and amplifying it.
Thank you so much, Anthony. And we have one final question that I'm going to throw out to the group, and whoever would like to knock it out of the park can feel free to do so. So, which foods in the Caribbean truly hit the sweet spot? Healthy, kid approved, and affordable. Are there any good models out there we should be spotlighting?
Well, I actually just answered it in the chat. So, so for the Trinidadians on the call, you know what chow is, what we call chow, which I guess in Barbados would be South-ish food, but using fruits and vegetables. And so that has really taken off outside schools and in our culture as a go-to snack. And, you know, there are chow challenges on TikTok and, you know, the rest is history. But the point is, it basically is fruit. The most common ones we use would be mango or pineapple or what we call pomsite. I think you'll call golden apple, which you cut up and you pickle it with lime juice and or vinegar and or salt and or pepper, right? And it's fruit. And I live next to a secondary school, so I see this every day. And then now I see corn, I see plums. And so this is, I think this is the model. It is wildly popular with teenagers. They sell it in little cups. So I guess the price points for vendors will be through the roof. And it's a cool thing to do. And so just to say, I think it's all about changing culture, changing environments, and I think it is possible. So circling back to the vendor outside the school topic, vendors sell this outside schools. Not every school in Trinidad, not every school, but it is, I think anybody on the call could agree, it's quite a popular thing that will be here to stay because people are trying different things. You can get cucumber, the cucumber man, the corn man, the mango man, da, 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 da. So just to say, we have to really call upon our Caribbean creativity to really go back to the land, something I'm very passionate about, and just find ways to make it interesting. And as an adolescent doc, I can say, once you get that teen buy-in, get that teen involvement, you know, the ripples become waves. So that's just my quick contribution to that question.
Thank you, Asha. I think that's fantastic. And Jen, really quickly, go ahead.
Yeah, if I may, we have a list in Barbados of snacks and beverages. Now, these beverages have no added sugar, and we have the snacks. They're not perfect. They're not where we want them to be in terms of sodium and everything else, but they're good of the bad. And what our experts, some of the experts in our coalition, the doctors and nutritionists, they literally went to supermarkets in Barbados and they sought out these products because one of the major complaints we were having from the canteen concessionaires when we first met with them is that there are no healthy products to be had in Barbados, and we proved them wrong. We said, okay, we're going to go out and find you some. We have a list of over 50 drinks and 50 snacks. We want to meet people where they are. We would love them to be able to sell fat ports and akis and dunks and cashews and guavas like when we were at school, but that's not going to happen. So we're meeting them where we are. And this list is on HSFB's website. It's on the Ministry of Education's website. So if anyone in the Caribbean wants to go and see what kind of healthy-ish things look like for the students and your children at home, then we invite you to go and have a look at our alternative list of snacks and beverages.
Thank you so much, Shannon. That alternative list, I've seen it and it is absolutely fantastic. We have some more questions. However, we could stay here all day talking about this topic, but in the interest of time, I would like to invite each of our panelists who have done such a fantastic job today to very briefly share in a 1 to 2 sentence, one key takeaway that you would like us to leave with after we end this webinar.
I guess I could go first as I started. I think one key takeaway, our messaging needs to be considerate of the adolescent developmental process. And so we need to engage young people in programming that we do and make sure our media and our approach and our language, they can understand it, right? So younger children are more concrete in their thinking. As they get older, more abstract. So the neuroscience matters. And parents, we need to engage parents. Parents are really integral to any process around behavior change in pediatrics and, well, children and adolescent health. So unless we get their buy-in, we'll be going around in circles. And so I know we all continue to do that, but as a collective, just that continued support, we have to keep parents in the center of these conversations. Thank you.
Fantastic.
All right.
Thank you so much. Anik?
Yeah, if I can, what I would like us to take away is that Rome was not built in a day. We have miles to go before we sleep. There is also what we need to look at called strength in numbers. It is a problem that the whole of society faces with the obesity children and stuff like that, it needs everyone to get involved to make the fix start to happen. But you don't eat an elephant in one day. You have to take a little bite here and a little bite there and a little bite there until we get where we need to go. So we need to come together. We need to make this happen for our children. They are our future. So let's hit the ground and let's continue to do the work.
Thank you so much, Jen. Shani?
Yes, I would say that my key takeaway is that we should all realize that our children deserve to be the #1 priority. We've been having the conversation around, putting people over profit and why that is very important. But especially when we come to our children, we recognize them as the most vulnerable of our society, and we should treat them as the most vulnerable, which means that we are making deliberate choice, and we means us as civil society as well, our policymakers, or the government, teachers, parents are making the choices that are for the good of our children, that are in their best interest, and that recognizes them as the #1 priority in our lives and as a nation.
Thank you, Shanique, and over to you, Paul.
My takeaway is it's clear that the business community and corporates have a responsibility. We need to figure out how we can actually be part of the solution and just make it happen.
Thank you, Paul. Anthony?
Yeah, thinking very much about that dish that Asha was talking about, and just the whole healthy foods. It's good to be this environment so that we can hear what's going on. But I think the biggest takeaway for me, one of the biggest takeaways, thank you for embracing the media. It's important. Usually you have forums like this and the media is absent. So let's continue to look at how we can strengthen partnerships with the media. We're not only here for you to come to say, well, after you've decided your strategy, here's what I'm doing, or to cut the ribbon when you're having a grand opening or something, but we are much more than that. And that relationship that we've built is really important. Let's continue it because we can help in achieving these objectives for the betterment of our countries.
Thank you, Anthony. And Sam?
I'd say one of my key takeaways is that change is here. We're actively working towards creating these healthier school environments throughout the Caribbean. Youth are engaging with the programming, parents are engaging, vendors are learning that there are alternatives that they can use and while still maintaining their livelihoods. So I just say that my key takeaway is hope for a better future.
Thank you, Sayan. This was such an inspiring and important webinar that we hope has not only given you food for thought, but also provided inspiration for action. Key takeaways definitely are focusing on how we can counter that industry interference, reinforcing the importance of safeguarding policymakers from the influence of unhealthy food and beverage industry. And we had such an awesome panel put together, a multidiscipline, multi-stakeholder panel. And we know that when it comes to achieving policy change, it can feel very overwhelming. And what we want to bear in mind is that there's a common quote that says, I cannot do all of the good that the world needs, but the world needs all of the good that I can do. So I would go even further and say that while we cannot do all of the good that our countries and our region needs in order to achieve policy change, the region needs all that we can do. The region needs all of the good that we can do. Our unique abilities and efforts are valuable, they're necessary, and they are in fact contributing to a healthier Caribbean. We want to thank our fantastic presenters and our panelists for a dynamic and important session. And of course, thank you to you, our attendees, for the valuable for the value that you have brought and for the engagement that you have brought to today's session. We look forward to continued engagement with you as we work towards this common goal. I am wishing you a wonderful rest of your day. Thank you for joining and goodbye.